What's up, sports rehab experts? Hope you are doing well. Hope you are doing fine today. Just gonna answer a couple questions that I've gotten lately, both from the YouTube channel and from members emailing me directly at greg@sportsrehabexpert.com of some questions that they want addressed. Two questions that keep coming up quite frequently is the topic of respiration and including it into rehabilitation and sports performance programming. So that's what today's topic is going to be. It's going to be a foundational kind of starting point of where you need to draw your attention to if you're going to start including respiration. And I highly suggest that you do start including training respiration as a component of your rehabilitation programs and of your strength and conditioning programs, because I've seen a dramatic improvement in my results the moment that I started introducing some of these concepts. But then as I've gotten better and better at applying these concepts, my results have just kind of continually improved and evolved as well too because of it. So I'm a big believer in this component, but I'm also a big believer in the fact that from my experience of dealing with this over honestly, actually, I got started kind of with the whole idea of respiration back before I was ever even in PT school. I ran track in college, and my first exposure to how respiration could be an effective part of programming or an effective part of training, it was in track and field. So I did decently well for myself. I was a 5-time Division II All-American, and that was through the 4x400 meter relay. So I ran the 400 meters, and as a freshman, my initial 400 meter time was 50, pretty much 50 flat, but I had not broken into the 49 barrier yet, which was really frustrating for me at that moment in time, especially going from high school to college. Obviously, there's a increase in the intensity and the volume of training that you're doing, but I wasn't necessarily seeing any improvement in my times. And lo and behold, I watched this random movie. It was called Never Back Down. Okay movie, not the greatest movie in the world, but it wasn't bad. Anyways, part of the movie was this training montage where the trainer had told the individual to just breathe, exhale, and he was, and this was a fighter. He was doing like a roundhouse kick into a big training bag and just trying to increase the amount of force that he was able to kick with. I have no idea what led me to this thought process, but when I was watching the movie, I was like, for the last 200 meters of the 400 meter race, this next time that I run it, I'm just going to focus on exhaling and exhaling hard as I come around those final 200 meters. And lo and behold, we had a race that next weekend. So I watched it during the week, raced on the weekend, and I was just like, I'm going to exhale that final 200 meters, and I'm just going to keep focusing on exhaling and breathing that final 200 meters. That's all. That's going to be my focus. Obviously, I'm running fast, but I'm just going to focus on breathing the last 200 meters. And I went from running a 50 down to a mid 48. And if anybody's familiar with track and field, if you've been training for a while, to drop a second and a half in the 400 meters is a pretty significant drop there, especially when you've been running the race as often as what you do through a collegiate scenario, and then running 4 years in high school as well too, to make that second and a half jump from a 50 to a 48 and skip the whole 49s. That's pretty significant there. So immediately my head kind of went to, there's something going on with this breathing scenario. So I focused on that for the rest of my athletic career. I ended up running a 47.9 was my fastest time, but nevertheless, that was my first exposure into the whole respiratory concept. So even before PT school, I was always interested behind this concept. Now, I will admit that I probably have gone pretty far down rabbit holes that have led me to, nothing but just more complexity and more frustration behind it too. So that's the thing that I want everybody before they get started with this, is to just understand that there's a limitation behind this, and also the amount of different factors that influence somebody's pain and performance is significantly more than just one component. There's a lot of different factors in there, and if I'm looking back at that race on that particular day, like there's different scenarios, from me going from indoor to outdoor track and field, and the weather finally starting to break in the freshman year, and finally, you know, there's an accumulation of training that you're trying to build up towards. So you're not really necessarily worried about times the middle or beginning of the year, you're looking for times at the end of the year. So obviously that type of training intent, training block, purpose of peaking towards the end of the year could have been starting to take effect at that particular moment in time. So there's a lot of snowballing effects of things that could have happened beforehand that just all led up to that particular point in time in that day. And it just happened to be a mixture of different things that just led to a perfect case scenario. So the same thing happens in rehab and in performance when you're working with somebody. Is like when you look at someone's breathing or respiratory mechanics, don't just assume that that was the only thing that made the change. Just like when you look at how somebody performs an exercise or certain movements or a certain manual therapy technique, even, like a lot of people will associate doing a particular intervention and then suddenly someone gets better after that particular intervention, but they never assumed kind of the consequences or the benefits of accumulation of things that have been happening in the background that led to that moment in time achieving an effective results. And that's the reality of treating human beings. That's a reality of working with human beings, is the reality of nonlinear amplification of all the different inputs that you've given that individual leading up to this particular moment in time. You have no idea of what all those influences had, or the impact that all of those different inputs could have had on that individual leading up to that particular moment in time. So we have to be cautious of assuming or coming to the conclusion that it's only one thing that gives the individual this achieved result that they may associate with one particular treatment intervention. Okay, so background aside, rant aside there, let's start getting into things that I think you need to know as a foundation of starting to include respiratory training in part of your rehabilitation or strength and conditioning programs. So the number one thing to first think about when we're talking about respiration, and the number one concept that you have to get ingrained into your brain, is what happens during normal respiration. So when we breathe in, the diaphragm is going to descend to allow air to move into the ribcage. Now, if the ribcage is moving effectively on respiration, we're going to get bucket handle expansion of the lower ribcage and pump handle expansion of the upper ribcage. And then obviously when we exhale, the opposite is going to happen. It's going to be a coiling or a compressive aspect to that bucket handle or to that pump handle action. So when we look at the lower ribcage, we need to understand that bucket handle is more or less a frontal plane movement, which is that swinging out action of the bucket handle, moving outwards. So that's the bucket handle expansion of the lower rib cage, pretty much anything from the sternum down. From the sternum up is more of your pump handle action at the rib cage. So this is the calipering up and down of the sternum that happens during the respiratory cycle. So again, we need to understand that there's two extremes to this. There's the inhalation and then there's the exhalation. So when you breathe in, we should see that swinging out effect to the lower rib cage and the pump handling up of the upper rib cage. And then when we exhale, we should see the opposite. There should be a closing down of the lower rib cage and then a closing down of the pump handle action. Now we also need to understand that the rib cage is a cylinder. So that being said, there's a volume of space, not just in the front and lateral aspect, but there's also a volume of space in the posterior aspect as well too. So if we're again looking at side view from a pump handle standpoint, we have the pump handle kind of moving up in the front, but we also have this posterior expansion that happens up in the upper thoracic spine. From the lower thoracic spine, we have this bucket handle, which would kind of swing outward like this, but from the backside, we'd also experience this outward expansion as well too. Okay, so we have bucket handle expansion and compression, then we have pump handle expansion and compression, and then we have the posterior aspect of the thorax expansion that occurs as well too. Now I'm going to add a fourth one into that, and that's down into the lumbar spine and the pelvis area. And what we have to consider here is how the diaphragm descends downward on inhalation So even though we're talking about structures lower than the rib cage, we still are going to experience some type of expansion and some type of compression occurring, because as the diaphragm moves down, it's going to be pushing down on the guts. And because it's pushing down on the guts have to have somewhere to go. So the guts will drop down into the pelvis. So the pelvis is going to have to orient itself in a fashion that allows for more area to absorb this increase in pressure of the guts dropping down. So that's where the pelvis is going to kind of flare outward into external rotation and sacral counternutation to create a bigger bowl to accept the guts that are dropping down. And because you're dropping that pressure down, you're going to feel that 360-degree expansion down through the low back, down through the pelvis. So when we breathe in and we talk about feeling expansion, the sensation of feeling expansion, we should also be cueing the sensation of expansion down into the pelvis, low back region, because diaphragm goes down, pelvis, pelvic floor, pelvic diaphragm has to eccentrically orient and eccentrically catch these structures to absorb that force, and then ultimately when you then reverse it into the exhale, then provide a concentric overcoming action that pushes everything back vertical, because we want that. In order to experience full respiratory excursion, we have to then experience a full exhalation and allow the diaphragm to ascend back vertical again. On exhalation, that diaphragm needs to start doming. The guts need to start coming back up, because we have an overcoming action of the pelvic diaphragm that is now ascending, pushing the guts back upward, pushing the diaphragm back upward. And if the rib cage is in an optimal exhalation position, then we can allow that diaphragm to fully dome again. Okay, so that's key concept number one, where we need to have an understanding of what's happening biomechanically at the rib cage, what happens when the diaphragm and the pelvic diaphragm kind of move in conjunction with one another up and down in this pistoning type action, and the guts that are in between, and how that's going to impact the sensation of pressure that the individual gets feedback from. Ultimately, when you coach somebody and cue somebody with this exercise or these activities, you're going to be talking about sensation a lot. So they have to, and knowing when and where they're going to be feeling extra pressure because of the respiratory cycle, that's where you can kind of start cueing in the individual's focus of the particular exercise and the particular intervention strategy that you choose. All right, so that's it for the first video here. Stay tuned for the second part of this video series. We're going to start going over some more specific applications as far as exercises that you can get into and start using with your clients to experience that full respiratory excursion on a rehab standpoint, but then also a strength and conditioning standpoint. Hey, thanks for watching. Hope you got a lot out of the information in today's video. If you like this type of content, if you could do us a huge favor by liking the channel, subscribing to the channel, and hit that alert button so you get notified when any new videos come out your way. Also, if you're a rehab clinician looking to take your clinical skill knowledge to the next level and seeing how you can better help your patients, visit sportsrehabexpert.com, where we got a lot more information that can help you along the way, as well as our certified sports rehab expert course. This is 2 courses that give you a sports rehab residency or an orthopedic fellowship type education in half the time at a fraction of the cost. So visit sportsrehabexpert.com to check out these 2 courses. We have the Human Assessment Mastery course and the Full Body Treatment Domination course. And finally, maybe you aren't a rehab clinician watching this video. Maybe you're someone just looking to keep an active, healthy, mobile, athletic lifestyle without painkillers and frequent visits to the doctor's office. If you're located in Ann Arbor, Michigan, you're in luck. Just visit annarbor.physio and you can set up your appointment today. If you're not from around the Ann Arbor or the Michigan area, no worries. We do a lot of online video consultation services from people all over the globe as well too. So you can reach us at annarbor.physio or at sportsrehabexpert.com, and we'd love to learn more about how we can help you out.